Hey everyone, and welcome to the Movement by Matt platform. Today we are covering self-assessment of the hip. For props, all we're gonna need is one static strap. That means it doesn't stretch. So something like a belt, even an iPhone cord will work, and a pen and paper. So what we're gonna be doing today is going through our passive and active range of motion in every direction of the hip. So we're gonna write down our passive and active of each one of our ranges. That way you have that data recorded, and I'd recommend that you prop up your phone and film yourself doing it as well. That way you can pair it to past and future assessments as your mobility improves and joint function improves. Okay, we're gonna jump right into it, and we're gonna start with internal rotation. I'm just gonna do the right side, so if you'd like to do both hips, you'll just play this video twice, or you can do it on your own once you know how. So I'm gonna start on my back, and I'm gonna hook my foot with the strap. Okay, from here, I've got my knee directly over my femur, and then I'm gonna take my non-working hand, so my left hand on my right leg, and I'm gonna brace the inside of my knee. I'm gonna slowly start to pull the foot as far as I can out into internal rotation, which is away from midline. So femur's rotating in, but foot's going out, okay? So this is 0 degrees. This is 10, 15, 20, 25, 30, and right at 30, I'm feeling my right hip wanting to hike. That is going to be my end of passive range. Okay, so end of passive range, find that number, and then we're going to slowly pull out into our active range, and I've got about 25 there, so slightly less. We're going to take a pause, and we're going to record both of our numbers. So we're going to write it down. I label it IR for internal rotation. Passive was 30, active was 25. So whatever your numbers were, go ahead and record those. And then we're gonna go into external rotation. So we're gonna do that same thing, but the other direction. So I've got my strap around the foot. I'm now holding the strap with my left hand, bracing the outside of the knee with my right. I'm gonna pull this foot as high as I can into external rotation, and I've got quite a bit here. I'm looking at about 80 degrees of passive external rotation. So 0 is here, 45 is halfway, 90 would be aligned with your waist. I'm just shy of that. So remember your passive range, and then let's go into active. So not using the strap, just pulling yourself into as far of external rotation as you can. And there I am at about 55 or 60 degrees. So passive for me is 80, active is 60. Go ahead and record those down, whatever your numbers were. And then we're gonna go into bent leg flexion. So bent leg flexion looks like this. I'm on my back, and I'm gonna pull my knee into my chest as far as I can. So if your femur or the top of your thigh can touch your rib cage, that's full range of motion, that's full passive range. You'll notice that the back will wanna lift up. If your lower back is lifting up, you're pulling too far. So keep the waistband on the ground and then pull as far as you can. So I've got about full passive range there, so I'll write full on my paper. And then I'm gonna put my hands out to my side and then pull the knee into the chest. And I'm just shy of where I was passively. So I'm gonna say 0 is here, 90 is here. That's about 135 to 140 on the degrees. I'm gonna go 140 there. Okay, so I'm gonna record full for passive, full, and then 140 for active. Go ahead and record whatever your number is. And then we're gonna go into straight leg flexion. So we've got our strap, we're gonna wrap it around the foot again. We lay on our back. We're gonna do the same thing, but now with the straight leg. So this is really testing more of the hamstring tissue than the actual hip joint itself, but we still like to take the measurement. So right here, I'm right at 90 degrees, okay? So 0 would be the ground, 90 is here. And then I'm gonna actively pull myself, and I've got 90 as well. So I'm gonna record that there. So straight leg flexion, passive is 90, active is 90. And then we're gonna move into extension. So extension is gonna be done from the stomach. So I'm gonna lay on the ground. And this one, unless you have a partner handy, we're just gonna do the active version. So if you do have a partner, you can have them hold your butt down and then pull your leg up as high as you can. We wanna make sure the front of the hip is touching the ground. And then we're just gonna drive up as high as we can squeeze. Look back, and I've got about 10 degrees. Notice how I'm not rocking this hip off the ground. Front of the hip is touching, and then driving leg up. Good. If you have 10 degrees, that is about all the hip extension we can expect. So I'll put passive as 10 and active as 10. Go ahead and record your numbers. We've got two more. We've got abduction and adduction. So abduction is lifting the leg up to the side. So we're gonna use the strap to do it. We're gonna hook the strap on, laying on my side. Notice how my leg is not forward here. So it's not out in this front plane. It's directly off my side. My pelvis is stacked on top of one another, and I'm gonna pull myself up. So I've got this stopping point here where I've got no more space on the outside of the hip. I can feel it. I'm right at 45 degrees, okay? What I don't want is once you hit that zone, you pulling the leg forward to continue going up. So you can see I have much more range there, but as long as I'm pushing that hip back as far as I can, or leg back as far as I can, I've only got 45. That's passive. Now we're gonna go active, lifting up as high as we can. And I'm a little shy, about 40 there. So my passive is 45, active is 40 on abduction. So passive 45, active is 40. And last one is adduction. We will use the strap on this one as well. I'm gonna lay on my side here, bring my top foot out front. My bottom foot is gonna push back towards the wall behind me, and then I'm gonna pull as high as I can up. So I've got about 35 degrees there of passive. Measuring off the ground is 0. And then active, I've got about 30. Bingo, okay? And I'm gonna record that. Passive, 35, active, 30. Okay, sweet, so we've got all of our data recorded now. I'm gonna cover some general goals of our range of motion. So keep in mind that everyone's range is gonna be a little bit different, and based on your sports and lifestyle demands, they could vary, but a general rule of thumb, a minimum we wanna have for everybody is gonna be the number, I'm gonna give. So we're gonna roll down in the order we did them. Internal rotation, goal for active range of motion, 25 degrees minimum, okay? External rotation, 45 degrees minimum. This is all active. Bent knee flexion, 135 degrees of active range. Straight leg flexion, 95 degrees of active range. Extension, 10 degrees. Abduction, 40 degrees. Adduction, 30 degrees. Okay, you can go back and review those numbers and compare them if that was a little fast for you. But if we don't have the active range of motion in any of these areas, we want to focus our class selection on these areas. So for me, the only one that I didn't hit for my goals is the straight leg flexion, which tells me that my hamstrings are tight. So I want to work more classes where I'm doing hip flexion and extension with the straight leg. So that will be noted on my focuses. So whatever you're short of, that's what we're looking for. Now, if you find yourself in any of the joints with a large passive range, so where we were doing it with the strap or helping with the hand, and a small active range where you don't have control, that's something we want to highlight and focus on as well. What that will mean is if we have a large passive range, our body allows us to go into that range freely with no restriction or fear. But if we don't have control over it, we're going to be entering that zone with little body awareness and control. So risk of injury goes up when we're in those ranges of motion. So for example, for me, my biggest gap would be hip external rotation. I had 80 degrees of passive and 60 degrees of active. That's something that I want to increase my active range. So I'm going to do a lot more hovers, liftoffs, end range control to build into that range of motion. So that is our hip self-assessment. I hope that was helpful. Make sure to do both hips. You'll be surprised to see right to left hip, what the differences and discrepancies are in your range of motion. I think that's always important to know. Hope you guys enjoyed. I'll see you next time.